These are the things we encourage. We talk to them about how to eat healthy. We do Kitchen Creations cooking classes where we buy all the food, but they do all the cooking. They get the recipes, all the sugar-free, healthy food recipes, because diabetes isn't about giving up sugar. We don't even make people give it up anymore. We teach them how to create a balance in the meals they eat. We give them portion plates where they get so many vegetables, so many starches, so much protein, their condiments, their fat, everything is in that portion plate, and that's what they get for a meal. And as they learn to use these plates, they take them out to restaurants with them. They learn to avoid places like fast food restaurants, McDonald's, Burger King, Taco Bell, Pizza Hut, because of the high fat content, high carbohydrate content in this food. It's not healthy for anyone. And that's our problem we see today. I mean, who doesn't know a child that's morbidly obese these days? There used to be a time when I was in elementary school, if I saw one kid in my entire school that was overweight, it was a lot. Now we can walk into an elementary school and about 50% of the children are overweight. And that's unfortunate. That's very unfortunate because you as parents, will end up burying your children, according to the CDC. They're saying that obesity is such an epidemic in our children that we, as parents, will end up burying our children because they're going to have the complications of diabetes, heart disease, hyperlipidemia much earlier in life by the time they're 16, 17, not in their 40s, 50s, and 60s like we see a lot of it now. But even as a healthcare provider, I'm seeing this in the 20s and 30s on my obese patients. And so we talk to them again. It's all about how we eat and how active we are. Very important. Always remember, you put out more than you put in. In other words, if you're eating 1,200 calories a day, burn 1,200 and 1,201. Always put out more than you take in. The more you burn, the less weight you gain, if any. Your better chances of not gaining weight is if you're putting out more. Walk more than you eat. Look at what you eat. Look at your foods. I'm going to see how many people know what causes high blood sugars. What does eating more carbs than usual do? Does it make your blood sugars go up or down? Up. Definitely up. Think about carbs. Carbs are glucose. They turn into glucose in your body and then is converted into energy if you're active. If you're not active, what happens to it? It stores as fat. Which should be your biggest meal of the day? Breakfast, lunch, or dinner? Breakfast. Exactly. Your smallest meal should be your dinner. Why? You're going to bed after that. You're going to have about 8 to 10, 12 hours of inactivity. Why do you want to store your dinner as fat? Makes no sense. The patients feel that their biggest meal of the day should be dinner. Should you skip meals? Never. Eat 3 meals a day. Don't let your body go into survival mode. When it's not fed, it says the next meal's going to get stored because I don't know when I'll be fed again. So don't let your body go into survival mode. Feed it. You will burn it as long as you remain active. Does less activity than usual cause high or low blood sugar? High. What about forgetting to take your diabetes medicine? High. Exactly. If you're sick, do your blood sugars go up or down? No, they don't. They go up. You're stressing the body. Here's a good one. If you drink, do your blood sugars go up or down? Alcohol. Wrong. They go down first. They crash. They actually go way down. I have seen, and this is the studies have shown, people who drink on an empty stomach with diabetes actually crash. And then they skyrocket, they roller coaster. Not good, not good at all, because you are probably trying to bring somebody out of a major hypoglycemic event. And that's very dangerous. Increased stress at work or at home, does it cause high or low blood sugars? High. Any stress on the body causes your blood sugars to go up. Excess activity. Low blood sugars, it brings them down. A late or a skipped meal, what would that do to diabetes? A low. If you have diabetes, people with diabetes, are they more likely to get colds and other illnesses or not? Or is it about the same? More likely. Your immune system is compromised. People with diabetes tend to get more thyroid illness, like hypothyroidism and Graves' disease, than people without diabetes. True or false? I can't hear you. True. True. Because again, autoimmune diseases, they go hand in hand. You see more arthritis, you see more hypothyroidism, you see more Graves' disease. I tend to see Graves' disease in type 1s. I tend to see hypothyroidism in type 2s. So this is something you also have to look for. If a patient is hospitalized with diabetes, but there's no indication on the chart that it's a type 1 or a 2, how would you know what the patient is?
I would say if they're skinny, it's a 1.
Mm-hmm.
If they're big, if they're overweight, obese, they're probably 2.
What about if 2 months ago they weighed 50 to 60 pounds more than they weigh today? What you'd think it would be? Late onset type 1. Remember, type 1s aren't only 2 and 3 and 4 and 5-year-olds. There is such a thing called LADA, late onset type 1 diabetes. So if you're watching somebody and they were weighing 250 pounds and are 5'9", and 2 months from now they're weighing 180 pounds, better look at their insulin levels, their C-peptides, their insulin autoantibodies, to see if they are late onset, if they are still producing insulin. Now, should we be putting patients with type 2 diabetes on insulin? Why not?
Because they are mainly insulin resistant, not necessarily automatically not producing insulin. They should still be able to produce some amount of insulin. We should start out with diet and exercise to see if they respond to that before.
We used to start out, good answer, we used to start out with diet and exercise. Now we're treating pre-diabetes. We're not waiting till we give them the quote-unquote diabetes diagnosis. We are treating pre-diabetes because the complications are setting in much earlier. So we are starting them with metformin. We are putting them on insulin much faster. 2 drugs. If they fail on 2 drugs, 2 oral drugs, whether it's metformin and glyburide, metformin and Januvia, metformin and Byetta, if they're not succeeding, they're going right to insulin. Because even though they're producing tons of insulin, it's not getting where it needs to go. So by injecting it, we're getting it where it needs to go, and we help better prevent complications. I'm trying to think what else we talk about. Diet and exercise. What to eat is something we teach patients all the time. Patients come in, I'll give you a funny story. It's funny to me and it's funny to my colleagues, but it wasn't funny to the patient that was experiencing it. She came into my office one day, first time ever, and she had lunch. She had a 1 o'clock appointment and she was carrying lunch. And they were those 6 miniature little frozen hamburgers. She had microwaved them and brought them in. She had a small bag of frozen French fries. And she did this for several visits. And finally I asked her, I said, why don't you eat lunch before you come, since your appointment is after lunch? She goes, oh no, this is my second lunch.